Have you ever wondered how much it's going to cost the next time you need medical care? So let's be honest. You've just made an appointment for a checkup or for a procedure, or you have to go to the ER. How much are you thinking in the back of your head? How much is this going to cost? Can I afford this? Will my medical insurance kick in? And these are very legitimate questions, because when people come to see me as a physician, I can't even tell them how much I'm going to charge them for a procedure if they use medical insurance, because there are literally thousands of rules out there. And because there are thousands of rules, I have absolutely no idea what anything is going to cost you, the patient. I want you to picture this. I want you to picture that you go to a grocery store and you get a jug of milk and a loaf of bread and some apples and some bananas, but there's no prices for any of these things. There's just a big question mark there. And so you go to checkout and you cautiously put things on the conveyor belt. And you ask, how much do I owe? And the attendant tells you, well, we have no idea. You'll get a bill in 3 months, and each one of those items could cost you $0 or maybe $20, $25, and you have to pay it. Now you have to get the food because everywhere else is this way, and you have to eat or you will die. And this is medicine. You go in, you consume a service, you have no idea what it will cost. The people treating you have no idea what it's going to cost you, and you wait 3 months. And if you can't pay it, well, you go into medical bankruptcy, which is the #1 cause of bankruptcy in America, and it's been that way for decades. Now again, this is an enormous problem. Medicine must operate like every other business out there with price and rule transparency. A jug of milk is $3.24, and you know what it is before you consume it. So, with any huge problem, there is a common sense solution that is fiscally conservative and socially responsible. And here it is. We need one set of rules for medicine with one set of prices. And if we were to do this one simple thing that every other industry does, we would save $6 billion, and that's with a B, $6 billion a year. Now that's enough money to insure every citizen of this great country. Reduce your copays and your deductibles to zero, and have money left over for other programs that are much needed. One set of rules, one set of prices. It is so amazingly simple. And you have to ask yourself why we don't have it. And the answer is fairly simple. The more complex things are, the more insurance companies can deny services, which means they make more profits and their shareholders are happier. But I would submit to you that having shareholders happier, while it is part of the equation, the biggest part of the equation is keeping our citizens healthy, making sure we know what we're paying. We know what we're getting when we pay it, so that we can enjoy this life, stand on our own 2 feet, have the opportunity to work, have the opportunity to grow, have the opportunity to have retirements that are sustaining. One set of rules, one set of prices. It's time that you and I started dictating what makes sense for us, not what increases the bottom line for the corporations. To learn more common sense solutions, to learn how you can personally get involved, and to be the change you wish to see in the world, subscribe to this channel, and we'll let you know when new videos are out. Please also check out the book I wrote, Universal Death Care, a solution for healthcare in the age of entitlement.